there continues to be a shortage of organs, and the current efforts being made are not enough anymore.
Throughout history, people have tried many ways to prolong life through substitution or restoration of defective/failed organs. Currently, orthotopic organ transplantation is the only effective way to achieve this. However, it is seriously limited by issues such as donor shortage, high price, immune rejection, and ethical conflicts.
Most parts of the human body can be classed as organs. These verified parts sometimes become defective and must be replaced by an artificial organ or prosthetic device. In almost all cases, these replacement devices are constructed of natural or synthetic polymeric materials.
The kidney is in the highest demand of the transplants, and the need for them continues to rise. The average cost of an artificial organ is $20,000, and about 2% of Americans have an artificial organ or joint. What could the best material possibly be to make an artificial organ?
Little to no advanced technology is currently available to totally duplicate a natural organ. Biomaterials must exhibit good compatibility with the blood, body fluids, and tissues with which they come into contact. The device must closely duplicate the function of the natural organ.
Artificial organs can be classed into 4 groups: bone and joint replacements, skin and soft tissue replacements, internal organs, and sensory organs.
Ordinarily, there are 4 basic steps for an organ manufacturing process: architectural pre-design, preparation of materials and construction tools, homogeneous heterozygous cell assembly, and post-multi-tissue maturation.
In many cases, it is necessary to replace a defective joint with a prosthetic device to alleviate a condition caused by an accident or a degenerative disease. Joint replacements must meet some specific requirements, including maintenance of normal joint space, good steady natural motion, firm and permanent fixation, readily lubricated, stress and erosion resistant, and permanent biocompatibility. Most joint replacements utilize polymers to some extent. Finger joints are usually replaced with a poly insert, and over 1 million replacements are made each year. More recently, polymer has been tried in this application. Many other parts of the hand, such as the bones, have been replaced by silicone rubber. Other types of joints, such as the hip or the knee, often involve the contact of a metal ball or rider on a plastic surface. The major problems that occur in joint replacement are wear with patient irritation due to the debris and loosening of the prosthesis, which result in unsteady motion and increased wear.
The skin is the largest organ in the body from the standpoint of weight or volume. At the present time, there is no material that can duplicate this complex organ in all of its functions. Over 100,000 people are hospitalized annually with prevent gross bacterial contamination and or the loss of body fluids and electrolytes. The most promising approach to this problem has utilized a composite system consisting of a collagen glythomycin inner membrane with silicone rubber outer layers. These materials attempt to duplicate the barrier properties of the skin with good success, but no material has yet been able to duplicate the other skin functions, and a true artificial skin does not yet exist. Satisfactory soft tissue material must have subtle long-term physical properties, rubbery, and not cause any adverse effects on the patient. Few materials can meet these general and some other specific requirements. For example, sponges and textiles might have suitable softness, but the ingrowth of fibrous tissues quickly renders these materials unsatisfactory. While many materials have been tried for a soft tissue replacement, the most common one is polydimethylsilicone, which can be made in the form of rubbery gels, tubes, and/or sheets with varying degrees of stiffness, one produced by varying levels of cross-linking.
The area of artificial internal organs includes the heart, lungs, liver, kidneys, pancreas, blood vessels, and the gastrointestinal tract. In addition to the obvious requirements of blood and tissue compatibility, these replacements often have highly specialized functions which are almost impossible to duplicate with man-made materials. Nevertheless, it is often necessary to augment or replace the function of these organs. Over 100,000 pacemakers are implanted annually to regulate heartbeat, and these devices are usually polymer coated to protect the electronic portions from the body fluid. Pacemakers have been used experimentally in animals since 1932 and have been used in humans since 1952 to treat Stokes Adam disease, which is a heart block. Implantable pacemakers were first used in 1958. The more recent versions of these devices are capable of varying the heartbeat rate. While there are 4 valves in the heart, almost all of the replacements are done in either aortic or mitral valves. A wide variety of designs have been devised for these valve replacements to reduce immune responses. While much of the surgery is done using natural materials, a large portion of these surgeries utilize synthetic polymer. Polytetrafluorethane in the form of a micro-expanded tube. While the natural blood vessel might seem preferable, in cases of advanced diseases, the other vessels of the body are often effective and would not be suitable replacement materials. A good example would be St. Venous veins, which are commonly used in heart bypass surgery, but frequently are too weak to be blocked or to be used in some patients. For this reason, synthetic materials are essential. The use of woven or knitted Dacron blood vessel prosthesis dates from the pioneering work of DeBakey in 1951, and this material is frequently the prosthesis of choice among many heart surgeons.